Now, continuing with our sterling run of wonderful speakers that we've had at this conference, I'm delighted to welcome Navyn Salem with a wonderfully lyrical name. Navyn is the executive director of Edesia, the Global Nutrition Solutions. Edesia, Global Nutrition Solutions. She founded Edesia in 2007 after a personal interest in Tanzania, which is her father's home country, led her to take action to address the critical issues of malnutrition and poverty. Edesia's mission is to treat and prevent malnutrition for vulnerable populations in the developing world through the use of ready-to-use foods, also known as RUFs. Using a model of entrepreneurship, collaboration, and advocacy, Edesia launched work in Tanzania focusing on local production and distribution of RUFs like Plumpy Nut and Nutri-Butter. Producing in both Tanzania and Providence, Rhode Island, and the factories that they have there, Edesia provides RUFs to fill international gaps in 12 countries, reaching 300,000 people. So it's really great work that they're doing, and here's Navyn. Thank you.
Thank you for having me. So I haven't won a Pulitzer Prize yet, like our speaker yesterday, but I am hoping for the Nobel Prize for discovering the answer to food, hunger. Hunger is food, and nutrition is fortified foods. And I'm happy to be learning many more acronyms that I wasn't aware of before, so that at Thanksgiving, hopefully I can say, please pass the OFSP, which would really, I think, impress my family and friends when I get back home. So, over the last 2 days of this conference, we've learned that there are indeed many solutions to the problem of undernutrition around the world, and that there are many new and exciting ways to deliver these necessary nutrients. We know the potential impact is extraordinary and necessary to improve the health of children and other vulnerable populations around the world. In the last 100 years, we have spent billions of dollars and come up with techniques to combat malaria, diarrhea, TB, and polio. But despite all the financing and effort, many proven solutions are still beyond the reach of many who need them. If these solutions aren't reaching the most needy, then we have failed. Children are still dying every day from completely preventable diseases, simply because of the location of their home. So just for a minute, can we all stand up and stretch? Okay. Stretch, stretch. Okay, now I'd like the front row to sit down. Yeah, you can sit too. And maybe a few more over in that corner over there. You can sit down as well. And we look at the rest of the room that's still standing. And that's typically, when we talk about delivery, how many people we are not reaching right now. Because you are all the 85% who live in the rural areas. So how do we reach the masses? You can now sit. Thank you. So today I would like to talk about delivery and logistics, something that we touched on yesterday. Humanitarian logistics is defined as the process of planning and implementing and controlling the efficient, cost-effective flow and storage of goods and materials, as well as related information, from the point of origin to the point of consumption, for the purpose of alleviating suffering for vulnerable people. It includes activities like forecasting and metrics, performance measurement, which are all necessary to make sure products are available for beneficiaries at the right place and at the right time. Unfortunately, it's not uncommon when a mother walks 15 miles to a clinic only to return empty-handed because what she needed was not available. This is often a result of poor forecasting by the facility and lack of communication by suppliers. Where's my clicker? Right here. Okay. So, this is a picture of a rural village in Haiti that I visited this summer. We scoured the countryside to see if our products had made it into the field. This is a picture of my foot. I admit a bad footwear choice for visiting Haiti during the rainy season. And lucky for me, I brought some waterproof hiking shoes as a backup. But the point I'm trying to make is that having just one method of delivery to reach a rural community is not enough. If the weather changes, a new mode of delivery, or shoe in this case, may be required. There are several common challenges facing the field of humanitarian logistics. Firstly, we don't recognize the importance of supply chains. Most humanitarian organizations have minimal resources and rely on the pipelines of UN agencies like UNICEF or World Food Program to get the products to beneficiaries. Second, a lack of established programming and direction or leadership in the immediate aftermath of a complex emergency can be especially challenging. It takes time for teams to assemble, and there's a degree of competition among international NGOs that are all vying for limited donor funding. In addition, people have nothing but good intentions at their core can actually cause more problems than solutions. Believe it or not, we are actually contacted by people who want to pick up products from our factory and fly them themselves to countries like Guatemala or Haiti. Without programmatic backing, this of course is not going to work, nor is it sustainable. Third is an inadequate use of technology. For example, tracking and traceability software that can feed this data about supply chain gives decision makers new ways to make efficient decisions. In the humanitarian sector, logistics and supply chain is still predominantly manual, unlike the private sector. At Edesia, we manufacture 4 different products to develop and treat and prevent the various stages of malnutrition. And believe it or not, each one has its own unique delivery strategy. These unique fortified peanut pastes were designed to solve some of the delivery problems in the first place. They do not need to be mixed with water or refrigerated, 2 things that were hampering the delivery of these solutions in the past. Second, they carry a 2-year shelf life, which allows us more time to get them to intended recipients. In the past, expensive therapeutic feeding centers needed to be set up at enormous expense to NGOs, and now the products can be given to mothers as a home-based treatment, empowering mothers to take care of their own children and lessening the burden on the health system. Plumpy Nut, which is designed to treat severe acute malnutrition, is purchased by organizations like UNICEF, disseminated to implementing partners on the ground, and is distributed through an existing local healthcare system. Supplementary Plumpy is typically purchased by the World Food Program when a disaster hits, like in Haiti, Niger, or Pakistan, and is distributed through monthly blanket feeding programs in an effort to prevent children from ever reaching severe acute malnutrition. And NutriButter is a preventative product that could be potentially sold in the marketplace to prevent. But each scenario has its own success stories and its own roadblocks. Edesia is not just a producer of these foods. We want to make sure that the products make it to the most vulnerable populations and that the results are effective. So just as we did in Haiti, we will soon be headed to Guatemala, Niger, and other countries to figure out what is working and what is not. Because after all, it is not the solutions we lack, but the efficient, scalable, sustainable models of delivery that we need to work on. How do we reach these most remote areas where 85% of the population lives? We know it's possible because no matter how remote a place you think you are in, you are sure to see a Coca-Cola sign. Or now, a house painted with vibrant colors representing the latest cell phone company. So what is it about these brands that make it so different about what we are trying to deliver in nutrition? Well, if you ask my kids if they'd rather enjoy a Coke or some carrot sticks, I think you can figure out the answer. These products are in demand. A micronutrient powder or a biofortified yellow squash is not likely to win a popularity contest against Coke. Yet the impact that these inputs have are among the most cost-effective, high-impact interventions you could hope for. We need to take a look at marketing and behavior change. I believe that behavior change is one of the hardest nuts to crack. Put yourself in someone else's shoes for a moment. You're an energetic, enthusiastic recent graduate of the University of Tanzania. You've just landed in our great country and tell us, hey, by the way, you wouldn't have this problem of obesity that is costing you $147 billion a year if you would just eat better, maybe have a little bit less McDonald's, add a few more nutrients into your diet. You could solve one of your country's biggest health crises, obesity, heart disease, type 2 diabetes. It's entirely preventable. We tend to oversimplify sometimes when we speak about development and progress and just how simple it is to make positive change. We also think that we know what people in developing countries want or should want. A study by the Monitor Group conducted on emerging markets showed that if given access to credit, It is not water filters or solar lanterns or fertilizer that people want, but rather gold coins, TVs, and wardrobes. Now, who could have predicted that? In India now, there are more people with cell phones than toilets. So how do we make it a dream to want to grow up healthy and strong? Should we use local role models or athletes? In an attempt to make fortification a little more sexy, I put together one possible ad campaign. This is Dikembe Mutombo, the 7'3" NBA basketball star who's from the DR Congo. Is it people like that who can actually get this message through to people that you could also potentially be 7'3" and become an NBA basketball star? The reality is there will be a different answer in every country and even in every village, as each has its own unique culture that cannot be understood without living it. As my team works in Tanzania, we have learned many things by living amongst the community we are trying to serve. Many of the concerns are often things we have never thought of before. For example, we told a mother that she needed to eat better while she was pregnant. That would ensure that her baby would not be born too early or be born with a low birth weight. She might surprise you with her response. Many of the women she knows who've had bigger babies are actually those who've died in childbirth. Now that is something that I had not thought of before. How do we address these challenges, as it's never as straightforward as we think? I'd like to look at 3 different models that seem to be working. The first is in Ethiopia, where the Ethiopian Ministry of Health estimates that 60 to 80% of the country's health problems are due to preventable diseases. The leading cause of mortality is malaria, AIDS, TB, diarrhea, and nutritional deficiencies. And with 85% of the population living in rural areas, they've designed a new program that will bring health services closer to the family level. It's called the Ethiopian Health Service Extension Program, and it provides 1 year of training and has graduated more than 15,000 workers. It's an ideal way to discuss personal issues such as latrine use, family planning, and the importance of breastfeeding. An IRIN report tells us the story of a graduate who's been able to share her knowledge with mothers. Within 2 years, she had convinced 785 people to construct their own latrines, improved family planning coverage from 3 to 25%, and exclusive breastfeeding by 72%. This is how you best do behavior change, not from the outside, but from within a community and from a trusted source. So what tools do we have to increase the level of access to hard-to-reach areas? One of the biggest advances in the last decade is, of course, technology. We have seen so many advancements in technology that give each of us the power to do better. The internet connects us to places that we could never reach before and allows us to do important work halfway around the world. Skype puts the power of video conferencing in every hand that has internet connectivity. The cell phone has allowed us to leapfrog over landlines. There are 5 billion mobile connections, making them nearly as ubiquitous as Coke. They allow farmers to know what price they can get for their crops through SMS texting, and many are starting to use mobile phones for banking and other financial transactions. The innovation and possibilities around the cell phone alone are astonishing. Maybe this was the limiting factor about reaching that last mile. But now we have communications and are connected like never before. This provides a tremendous opportunity for marketing, supply chain management, tracking data, and opportunity to do real-time monitoring and evaluation. Another model is in Uganda, and it's called a living goods model. Across the developing world, the current health system is flawed. It is a day's walk to the nearest clinic or pharmacy, and once you get there, you realize that what you need is out of stock, the staff is untrained, the prices are inflated, and there is even a risk of counterfeit drugs. So let's look at how one organization decided to try something new. Living Goods is an Avon Lady-style network of door-to-door health promoters who make a modest income selling essential products at an affordable price to the poor. The model reduces illness and death by simply providing access to proven health solutions. The women are trusted members of their communities and are armed with products and the ability to educate consumers. The women market a diverse basket of goods, including essential items, and emphasize prevention. Bed nets, condoms, water treatment tablets, and personal care products are among the list. In the nutrition department, vitamin A, iron, pediatric zinc, and for the management of acute diarrhea, fortified foods, and iodized salt. They soon hope to expand to solar lanterns, cook stoves, and even seeds in the near future. The women work on an incentive-based model, and therefore they make money as they create more impact. The model is proven to deliver public health outcomes at a fraction of the cost of traditional approaches. In the living goods model, field agents visit health promoters once a month to resupply, collect payments, and provide ongoing health education and business coaching. They have collaborated with organizations like BRAC, who can bring microfinance and scalability experience to the table. There are even more opportunities with mobile phones, creating the ability to track pregnant women so that the nearest clinic knows when she's going to go into labor. It will also allow branch managers to know what products are selling and which are not. They currently have been able to reach 500,000 people with 600 health promoters and hope to grow to 3,000. The model is scalable and can be replicated in other countries. And the last example is bringing a creative delivery solution by bringing production source closer to the need by the building and scaling of small to medium enterprise capacity. This is an example of one of our factories in Niger. These kinds of businesses are critical to the economic development because they create jobs, they support local agriculture, and foster an independence from imports as they are empowered to make that change in their own country by using local talent and resources, not to mention the reduction time in transportation time and costs. So I'll use the example of the Plumpy Field Network, which Edesia is a member. The Plumpy Field Network is a network of manufacturers who make ready-to-use foods that I mentioned before. They have revolutionized the treatment of severe acute malnutrition and can deliver nutrients in a shelf-stable peanut paste. What we often don't talk about is the ingredients in the recipe that are not accidental. The majority of them, peanuts, milk powder, vegetable oil, and sugar, can either be grown locally or available on the local market. This allows local production to be possible and sustainable. The next step was to figure out how to deliver it to the people who need it most. On one of my trips to Tanzania in 2007, an NGO had recently received funding to purchase RUTF. They purchased the full amount they could under the grant. Thousands of boxes started to arrive in the warehouse. And then, only then, did they think about how are they going to get it to the children who needed it. Turns out there were just a lot of steps to get there. And first was to get the government on board and agree that this is how they want to treat severe acute malnutrition. After that, we needed to develop national guidelines so that the entire country was familiar with the protocol. Next, we had to train healthcare workers on how to diagnose the problem, and finally teach the mothers how to treat their children, and then require them to come back for more supplies and a chance at data collection through monitoring and evaluation. I realized then that we could not even think of local production until we had achieved these preliminary goals. In 2005, there were many critics who thought it was not possible to build factories in developing countries. They would have the quality standards high enough to reach those of the most rigorous audits and be able to supply international NGOs. But today, Edesia is just one of 13 suppliers in our network. Factories in Malawi, Madagascar, Tanzania, DR Congo, India, and Niger are just some of the ones that are locally owned and operated. And I'll give you the example of Madame Cisse, who's pictured there. She started making these products in her kitchen in 2004. When she was approached to see if she wanted to expand, she jumped at the offer. After several expansions, she is now able to produce enough RUTF to reach 75% of her country's needs, which if you have heard anything about Niger, that is remarkable because this year is yet another year where something like over 300,000 children are suffering from severe acute malnutrition. So this is just one of the success stories that illustrates that these businesses can be replicated. We are now looking to work in countries that are even more challenging, such as Sudan, Yemen, Nigeria, and Haiti. Because RUTF is intended to treat the most severe cases, it is purchased by the NGO community and given for free through the health networks and works like a food by prescription. The next step was to look at the problem from the other end of the spectrum. How do we prevent malnutrition from happening? We wanted to look at a model that did not depend on international aid streams, something that could be sold in the marketplace. This is when we started to work on a social marketing product, which is a small 20-gram daily dose of a lipid nutrient supplement, or LNS. I just want to make sure you learn some new acronyms as well. And from the looks of it, I think everybody has a sample in their pocket, because every time I go by my table, they're gone. So there is, I want to explain now what all those packets are used for. So there is a crucial window in which the time malnutrition can be prevented, and that is between conception until a child reaches the age of 2. Most people in the nutrition community are now referring to it as the first 1,000 days. If we do not act during this period, the effects of malnutrition can become permanent. I'll just repeat that one more time. The effects can become permanent. In Tanzania alone, 38% of the population is stunted. This product was designed that would be targeted at 6 to 24 months and would deliver the essential micronutrients and fatty acids a young child needs during this critical time. Studies have demonstrated that LNS can enhance linear growth, but is it possible to find the right marketing mix to be able to develop a product for Tanzanians? Now we need to look at the obstacles. Can we cover the price of production, marketing, and distribution? Can we ensure a clear message that this solution is not intended to replace or displace breastfeeding, but is only a complement? What are the rules and regulations regarding marketing to young children? These are some of the issues we're tackling right now. We don't have all the answers, but what are some of the first steps that we can take? There's a lot of talk about reaching those 4 billion people who live at the $2 a day or less at the bottom of the pyramid. But it is going to take a drastic adjustment to our typical business model. The Monitor Group recently questioned multinational companies on this topic and concluded that not only marketing and distribution are unique challenges, but the product offering itself needs to be altered dramatically. Companies are starting to realize they must invest in educating both consumers and suppliers, which may require more dedicated and specific resources. Companies realize that they need new and on-the-ground technical expertise, and therefore are looking to partner with local NGOs and community organizations with experience in target communities. And lastly, the challenge of regulatory environments and the lack of physical infrastructure require companies to be exceptionally innovative. The bottom line is training and development is key, and we need to invest if we want to increase our reach. We need to allocate adequate resources to demonstrate how timeliness and cost-effectiveness of delivery can improve over time through planning, forecast, and communications. A focus on metrics and performance in general is necessary, and like the private sector, we need to focus on not only getting the job done, but actually measuring how well the job is done. These are only a few examples, and we need to continue to think outside the box. There is not a simple one-size-fits-all solution. It will take creativity and innovation, but whether it's a bicycle, a pushcart, a truck, or by foot, I am certain we can get there. While we need to think differently, we must also look at existing infrastructure to make sure it is cost-effective and sustainable. Whether it's a government's medical supply chain or use of existing agricultural extension officers, or collaborating with groups we once thought as competitors. We need to share resources and ideas, avoid duplication and redundancies, understand that it takes many kinds of interventions to truly make a difference. We need to look to successful consumer brands to learn from so as not to reinvent the wheel. We need to collaborate and join forces. That is not something that we can do alone, but it can be done. Today, I put out the challenge to those of you to want to help to figure out how we put all these pieces together to go that last mile, to reach those who most need it, and to make a huge sustainable impact. We are ready and willing to contribute our knowledge of ready-to-use foods to treat and prevent malnutrition, but we need public-private partnerships, government, for-profits, and nonprofits to finally get together to reach the bottom of the pyramid. We know that what is needed because it's the same food and nutrition that we feed our own children. It's a basic human right, and we must continue every day to fight for it. Thank you.
Gee, thank you very much, Navyn. I've seen that factory that you were shown, that's in Niger?
Yes, but mine's not working.
Oh, take this
I'll
one.
try another one. Hello. Yeah,
Is that one going?
State Department one.
Yeah, there you go. I've been to a plumping nut factory in Ethiopia, and it was immaculate.
Has to
Clean.
be.
Yeah, it was amazing. They made me put on all sorts of stuff to go through there and things, and it was brilliant.
You'd look good in a hairnet.
And the hairnet, the shoes, standing in a box of lime, or all sorts of things. So it was. I'd never had that rarely in the United States, and certainly never in Africa. So it was quite impressive. Yeah, I was just wondering. I mean, you speak with such passion and force about what you're doing. How did you get started in this? What was your, the motivation and what launched you?
Well, I have a business background, so I was once in the world of marketing. But after I had my 4 daughters, things started to change, and my priorities changed. And I really wanted to do something that focused on children. And as I mentioned before, my father, my grandparents, and great-grandparents are all from Tanzania. So I thought I would combine my business background with my interest in children and try to do something in Tanzania. So I've been going back and forth there for a number of years and trying to get this factory off the ground, which, after working with the governments and all of those many, many phases it takes to get started, I'm proud to say that it will open by the end of the year, finally, and produce enough of these products to serve the entire country of Tanzania. So that's really exciting.
Yeah, that's great, and kind of the personal connections or the motivations, are often fascinating. And I'm assuming with, just considering your daughters, and as you said, the advantages that they have, and just wanting to make sure that children around the world also are able to access that and have those same advantages.
Right. It's hard enough being a mother here that I couldn't imagine trying to do it in the conditions that most of our world lives in, and they have enough challenges to deal with, and how could I make life a little bit easier and more manageable? So this is what I decided to do.
We were talking earlier, and we'll go to questions right away, and one that some may have because it's risen or has come up and arisen on this whole issue of plumping nut and other ready-to-use foods. In terms of the 2 schools of thought of delivery or getting them out to the population, which is either kind of handed out for free in kind of a humanitarian aspect, or through the markets, and to have some kind of payment system. The argument being that makes it more sustainable. What are your thoughts on that?
Right. I mean, I think there's 2 schools of thought, and I don't think that one's right and one's wrong. There's definitely pros and cons to both. And our products, we're actually trying both approaches to see which is going to work better. So if I just take the example of NutriButter, which is intended for the under 2 population, right now it's being distributed for free in countries like Honduras and Guatemala, Cameroon, and Malawi for the first time on a large-scale distribution. And while we will be looking at the results of those programs and how the impact and how successful that is, we're also in Tanzania working on a study to see, well, what if we took the same product and tried to sell it in the marketplace? What would be the right price? What does the taste look like? And would mothers be willing to pay for it? And on the one hand, sometimes you can't always see the results of micronutrients and deficiency because it's that hidden hunger, but we did a similar study in Niger, and a lot of the mothers said, I can see a difference in my child. She's more alert, her eyes are brighter, her hair color is different. So there are signals to mothers of why I need to incorporate something like this into my child's diet, because I do see a visible change. But it's hard when you've got both models going on in some countries. So you've got some being given out by a humanitarian organization, and then 2 years later, maybe they're expected to pay for it. Well, we've started down this path where it's expected to be for free, but if anyone from the NGO community mentions the word capitalism, you're instantly that's a dirtier word than bio, I think, when you're talking about actually charging people something. But there's real value in this product that we're offering, and it will simply change the course of your child's life. All of those other inputs and approaches that we try to reach kids with, whether it's education or many other noble ways that we try to intervene, can't be as successful if we don't start that body off with the tools that it needs to learn. And it's been proven that if we reach them at these early windows of opportunity, that their bodies and brains will develop, and it will give them a chance to do well in school and have a good job. It really does impact them lifelong. And so there's many ways to look at it, and we're trying them both. So hopefully I can let you know which one works. But my guess is it's going to be a little bit of both, depending on the country.
We can call it howdyism. Is that no? Questions. I've probably been ignoring this side of the crowd. Since I'm right-handed, I tend to shift over here. Any questions over here? Yep.
Thank you. I'm Mona Calvo from the U.S. Food and Drug Administration. And could you elaborate for us on some of the regulatory constraints that you're faced with, both in our country and abroad?
Here, we've actually not had any issues, I'm happy to report. We've made it through several regulatory audits so far, but we're also held accountable by UNICEF and Doctors Without Borders, who will be coming to audit our factory in about 3 weeks' time. I think it's important to note, though, that these factories that are in hard-to-work countries are also passing these same audits. And that's what makes this network really remarkable, is that you can develop capacity in local production that has the highest standards that we hold here in the United States or in Europe by the decision makers at the World Food Program or UNICEF. And that they've been very successful in handing down this model so that traceability and tracking is really important to make sure that there aren't any issues. We have constant testing before, during, and after the process to ensure that all these products are delivered safely and of a very high quality. Because after all, we're dealing with 6-month-olds and that are very sick. So it's of utmost importance that the quality is really above the standard. In terms of regulations in Tanzania, we've definitely come up against issues of marketing, and that you're not allowed to market to the under 2 population. And there's many schools of thought that say that breastfeeding is really only what should be advocated for. And while we're advocates of breastfeeding as well, that's just simply isn't doing enough either, or 40% of countries wouldn't be stunted today. So what can we do? How can we do a better job but stay within the guidelines so that we don't discourage breastfeeding or any traditional eating practices, but just provide a complement to that to really round out the diet and allow those stunting rates or that hidden hunger to really, those numbers to come down.
Thank you. I'm just wondering if kind of any of the folks from Africa or any of the other countries that Navyn has mentioned, if any of you guys have any thoughts about deployment of these products that you've seen in your countries, or any thoughts about any challenges or roadblocks or marketing aspects or things. So I'll just throw that out there in case anybody has before we move on to any other questions. Oh, right here. Yep.
Thank you very much for your nice presentation. I have 2 questions. First one, how many years it took to come up with this ready-to-use food to distribute in the countries you have mentioned? And number 2, although you have talked about facing some problems, like local problems, how do you overcome some local problems to produce and distribute these kind of products? Thank you.
Okay, good questions. The ready-to-use foods were developed by some French scientists in France at a company called Nutritious. And these have been developed over the last 20 years, so it's certainly not something that I take credit for developing. And they really have revolutionized the treatment of malnutrition and increased access to thousands, if not millions, who couldn't access these types of solutions in the past. So I work with Nutritious every day to figure out how we can increase that local capacity as well, because they don't want to just hold all the production in France. they're really strong advocates for local production and bringing these businesses to local areas. So we're looking at Haiti right now, and we found a partner in Haiti to expand there. And next are in very early stages of looking at Guatemala and being able to set up local production there as well. And in terms of roadblocks, they come up every single day. So we've been able to make it through every single one that's hit us so far. The one about marketing to under 2-year-olds was just brought to my attention in the last couple of weeks, and so we haven't solved that one yet. But I'm sure that there is a way that we can solve it or figure out another solution to reaching that target population, because it is so important to reach them, and we feel very strongly about that. And yes, there's endless roadblocks. I mean, for a small while, I thought that I could set up this factory in Tanzania by myself. And I quickly learned that that was a very naive way to look at things, and that when I went to try and buy land for the factory, I was going to be charged triple the price. Because even though I might have some roots in Tanzania, that doesn't qualify. I'm American now, and therefore you pay the Mzungu price, which is triple. And it just kept going on like that. We had, I don't have a degree in corruption and bribery and how to handle those things. So I was okay with, all right, we've got to change directions here. And that's when I found a local partner who's a successful businesswoman who had been already making a whole line of fortified blended foods and delivering them. So she was a respected member of her community. She had an interest in nutrition, and she even had a humanitarian side to her, and she had a school feeding program on the side. So she was the perfect partner for me in Tanzania to say, Anna, you are now the front of this project, and I will just disappear into the background and be your support. I've already done the customer development and the government work. I'm just going to hand it over to you, and you're in charge. And since we made that change, it's going much better.
I'm looking for particularly kind of first time, as we say on talk shows in the United States, first time caller, long time listener, first time caller. So you guys have been long time listeners for the 3 days. If there's any people, say, who haven't asked any questions, I know there's Ruth. You've been on a panel, but go ahead, because I know you're in the field working with these folks that are involved in this. So.
My first time, no. I just wondered, Navyn, first of all, to congratulate you for your passion, and clearly you are addressing a very needy problem. But I think one of the problems we've had, I don't know where you get most of the raw materials from, because you said you also support local production. Plumbinut is mostly groundnut based. A lot of African groundnut is laced with aflatoxin. That's a major, major problem for us right now. So I just wanted to know where most of your groundnuts come from, and whether you actually test for aflatoxin levels in the groundnuts, and how much of it is actually imported into Africa.
Peanuts are almost exclusively purchased locally. The downside of supporting local agriculture is it's much more expensive, because when I buy my peanuts in Providence, they're shelled, roasted, ready to go. I don't need to check them. I know that the quality is uniform. But in our factory in Ethiopia, for example, they've got to take the shells off, they have to roast them and sort them and do the aflatoxin tests as well. So they have 3 extra steps that they have to take in an African factory to ensure the same quality that I have. So the unfortunate part about it is it does add to the expense. But so you're always trying to balance being able to support local agriculture, but understand that you're paying more for that you could alternatively import from Argentina into Africa, and it might be cheaper. So you always have to be looking for the balance of making sure that it's not extraordinarily more expensive, because really we're trying to reach more children, and that's why we're always pressuring our raw material suppliers to get their prices down, because it directly results how many children we can feed. So it's a tough balance. But in Africa, we're trying to work with many American universities to figure out how to do better, have better storage facilities for peanuts so that we can cut down on aflatoxin levels, and ways to sort of improve efficiencies across the board. But there's a lot of work to do there, and it's definitely a very many, many steps that they have to go through to ensure that that quality does meet what is very easy for me to do here in Providence. But we do feel strongly that as many of the raw materials as we can, we get from local suppliers. We're also trying to work directly with cooperatives. So if we cut out the middlemen, perhaps then we're able to save there and get the cost closer to what we might be able to get here in the United States.
Thank you. Any other first-time questioners? You, sir.
Yes? Do you hear me? Okay, my name is Jeroen Bordewijk. I'm on the Program Advisory Committee of Harvest Plus. I enjoyed not only your talk, but also I think it is very important at this moment. My background is from private sector, so I also have been working in Africa myself and understand the issues about really building up supply chains, doing the marketing right. And you have been here now for the last 2 days, I understand. So I hope that also you are able to give some advice to Harvest Plus and to Howdy and his team, what they should do at this moment in time with the Harvest Plus program to move from research, development and first testing in the countries to really a full rollout which have real impact on the millions of people out there. So can you provide some advice maybe on this moment to share with us, but maybe also afterwards in a more wider sense?
Use your marketing background.
Well, I think it's always important to be able to work with governments in the countries that you're hoping to work with, and work with the ministries of agriculture to see that if there's some agreement in the benefits that you're trying to provide. And I think in terms of delivery, you're going to come across the same issues. Are we going to charge for these seeds, or because it's something new, are they going to be given away for free to begin? And if so, how do you translate into actually asking people to pay for these things? And because I really think that behavior change really is challenging. And while people are very happy to take it for free, that understanding the value and why you should pay for something is really, really challenging. I mean, I look at my own household. I can't even convince my kids to do the things that I want them to do, and I'm there every day beating them over the head with eat your fruits and vegetables. This is better than eating a granola bar or something. So I think that you'll have those same challenges of distribution and delivery. But really, I think partnerships with the private sector, to me, is what I hope to make some collaborations with, because there are people who do this well, and I would really like to work alongside them, and truly to even work alongside my own competitors, and see if we can't share distribution channels, even though I might be offering also something that competes against me. But being able to offer many different solutions and products to consumers, I think, is important. And so that really is definitely thinking outside the box in terms of approaching someone that you never would have considered and saying, how can we work on this? Because we really believe that it's the right thing to do. And sort of getting past some of those hurdles. But that's really asking a lot of people to do. Not everybody's comfortable with that.
I've noticed that kind of in the realm with social entrepreneurs, that they have such a belief in what they're doing in the product, and knowing that there's such a vast need out there that even approaching competitors or willing to work with competitors becomes a driving motivation as well, because you just realize the need and that needs to be satisfied, and you yourself may not be able to do it, but perhaps you bringing in these other people. Your hand has been up the longest, so.
I join others in congratulating you in the presentation. I think, though, it's very important that we be a bit more precise on who is your target group. If this is treatment to prevent death and disability, I'm all for it. If this is going to be a way of feeding children, as a pediatrician, definitely a nutritionist, I don't think this is the way we should feed children. This is something to prevent death and disability. So it means that you need to define who is your target group, and is it self-assigned, is it health worker assigned, Is it market assigned? Because theoretically, if you put marketing, this could be the way to feed children forever, everywhere. And definitely, I think this needs to be targeted where you have increased risk of death and disability. And how you do that becomes very important, especially when you're giving it out for free, and I'm not sure it'll be sustained. Many solutions have arrived to developing countries, and just as they arrive, they leave, unless it is governments, community-based, sustainable. So I'm not challenging you what you've just shown because it's beautiful. I'm just saying
It's a good
I
question.
want to know more about it
Yeah.
so that I can support you, or otherwise, if you don't have the answers, I will have to say, this is okay, but give me answers before I give you my benediction rather than condolences.
A fair question. I mean, really, these ready-to-use foods started in just the treatment of severe acute malnutrition, which, if I can say, only impacts about 25 million children. So I say only because I think it's worthwhile. But in the grand scheme of things, there are, of course, under 1 billion people who are undernourished in various levels. And so that's how the concept of these peanut pastes got started. But you're right, that's not sustainable. And we can only reach a small percentage of those 25 million children who suffer from severe acute malnutrition. So, of course, the question always is, how do you scale it up? Of course, we know the products work. We know they can transform a child in 4 to 6 weeks with over a 90% success rate. But what if we're not reaching all of them? And I think that's where the idea of a NutriButter product came about. That it's not sustainable, that aid is not a way to treat every child in the world who's suffering from malnutrition. What it is exceptionally good for is the disasters. Those are things that we cannot prepare for. No matter how much development or planning you do, the earthquake in Haiti or the droughts in Niger or the floods in Pakistan are not something that we could have prevented. And so a product like this is needed and works and has great results. But again, that's also a small part of our world. And how do we address a more long-term approach? And that's where NutriButter came along. And we feel strongly that it should be something that's marketed and sold in the marketplace, like I would purchase a multivitamin for my own children. This is a way to just package all of those essentials that's specifically designed for that population, and an easy way for mothers, because they have so much spare time while tending to their fields and raising 6 children. Of course, they have time to go around and make sure they have every micronutrient that their 18-month-old needs. So we're trying to make it a little bit easier to be able to impact that hidden hunger and that stunting that's going on. And we really would like to try to make this a market-based approach so that it is sustainable for the long term, and that we can reach every country. This is not just something that addresses those who are in poverty. Every single child needs these essential micronutrients, not just the bottom 1 billion. Every child needs these micronutrients. But today we're being blocked with people who don't agree, that feel that it is potentially criminal to be able to market a product like this to young children. So I think first we'll have to find a collective way forward on how do we solve these problems and make them sustainable. While I might have my own ideas, a lot of people will disagree with that. But I think that I really want to make sure that we're still around. I see so many NGOs who come and go. You see the sign on the side of the road, and, well, what happened to them? They ran out of funding. Okay, I don't want to be one of those who runs out of funding, and I don't want to give up on this project. I want to make sure that it's there for the next generation, and we've got to reach these kids now. So it's exciting that in the last couple weeks we've sent out 300 tons of NutriButter, which is actually 15 million sachets, which USAID has purchased. And what's exciting is that USAID has recognized that this critical window of under twos is something that they see as important as well, and that this topic is getting a lot more traction. That we don't just wait until the child is severely malnourished and on the brink of death, because that's when we can raise donor funds to come in and save the day. Prevention is just not as attractive to donors. So when USAID said, we're interested in this NutriButta thing that you have, we were so excited that this scale of agency was interested also in prevention. And we have roadblocks, but we always have roadblocks, and we'll figure out the right way forward. But it's really exciting that all 15 million of those are on boats right now to 6 different countries. And so we'll be looking at the results of the impact that we can make in the next couple months on how the delivery was done, how well the distribution went, how the different NGOs manage that type of exercise, and of course, what is the impact that we made in those communities that they're going to.
Bravo. Bonnie, how are we doing? Should we be breaking? Maybe a couple more questions. Do we have? Here we go. We'll take you two guys.
And I'm just drinking the water. Drink the water. The next
Hi, Navyn, this is excellent work, but I have a question. Given how aid, especially aid that comes from outside, distorts markets locally, particularly markets that local farmers have to access, what do you think about teaching women locally to make these products and feed their children rather than bringing them from outside?
That's a great question. I mean, while we have local production in 13 countries, of course there's many other countries who need it as well. At this point, we're trying to position them strategically in a regional fashion, because it's very capital intensive to be able to start these factories. The equipment's very expensive, and working capital is always a constraint. And but we have had crazy ideas, like maybe developing a mobile truck that could go around and be equipped with mixers on the truck and somehow be able to make it on a local scale. We have tried actually doing cooking lessons in villages as well. The scalability of that, of course, is extremely labor intensive. It's not something that can't be done, though. I think we'd have to think through how we can reach that at every level, that maybe instead of selling something in an Avon Lady style, that there would be cooking classes that could be given, and a ready-to-use peanut paste could be one of the recipes. That's something that we're actually looking at in Tanzania. There's a group that's developed a cookbook that is designed specifically to make recipes that ensure that you have all your essential micronutrients that you need, but without talking about micronutrients, but creative recipes that people can make with the inputs that they have accessible to them. So perhaps we join their cookbook, and maybe we could introduce PB&J to Tanzania. I don't know, but on a healthier front, of course. That's a good question. Thanks.
Yeah, I think that's one of the holy grails, not the peanut butter and jelly, but to bring these efforts down as much to local production,
because it can be made,
and community use, because it then drives employment opportunities, more things for the farmers and for the women of the communities to do. Yep.
I certainly do applaud the strategy you adopted, going to the grassroots and understanding the issues at stake. You did mention the fact that there is a difference between what we think people need and what they actually want. I was in Ghana in March, and my friends have 2 mobile phones but won't buy distilled water, right? So do you have any thoughts on how we expand the 1,000-day window to 10,000 days? Because the higher incomes, or those who are earning a lot more money, have the diseases that we are talking about here, the diabetes and the hearts. It's happening. How do we expand that window of 1,000 days to 10,000 days so they can make lifelong choices on nutrition?
That's a tricky question. I mean, I think I'd say that education is always the key behind all of this in terms of behavior change, and how do we educate to understand the value of expanding that to a lifelong. Of course, we shouldn't just have good dietary habits for our first 2 years, but hopefully our entire lives. And how do we get those points across? But it's really challenging. We can't even do it here. And so I don't know that I have the answer to how to get the knowledge that we have. We know that prevention is better. We know that we should have all gone for a run this morning, right, before we got here, and not eat packaged foods all day. But we're in a hurry. We're busy. We've got a lot of work to do. We have a lot of things on our plate that it gets pushed aside. So how do we talk about it more and encourage that prevention really is going to make you have a much more enjoyable, longer, healthy life where you can be productive and happy for all of your years. So it's a really tricky message to get across, and something that we can easily just push aside. But the way I'm going to do it is just keep talking about it endlessly until people are sick of listening to me talk about this, just as tired as my children are of listening to me. So
We'll have one more question from back there, Bonnie. Because of the sartorial splendor in the green shirt, we can't pass that up. So that's
Thank you.
And we don't want Navyn to stop speaking. So please.
Thanks for such an interesting presentation. Being a conference on biofortification, and as we are talking about scaling up and marketing and all that, can you draw some synergies and sort of highlight how you foresee what you are doing using the products from the biofortification approach? Because I didn't really get that out of your presentation.
Well, I think relative to the work that you are all doing, and I commend you for all the efforts and hard work that you're doing, which most of was completely over my head. But I think that there are still some synergies there, and like I spoke about the living goods model, they're very interested in talking to someone in this room about how do we continue to move it back. So that you're starting, with the actual seed. And I think that there's a lot of interest in those arenas that I can help connect some of you with potentials who want to try these products in the hard-to-reach rural areas where, of course, all of our farmers are. So I'd be happy to put anyone in touch with at least some starter conversations on how to look at your products specifically and how to get them out into the marketplace and that last mile we're trying to reach.
Thank you. Thanks for a great presentation and a wonderful discussion. So let's all thank
Thank you.
Navyn and